Welcome to DBC Diaries episode 34. Today you're going to see returning patient Beverly. She's here doing an IV this time, but last time she was here, it was actually for our intrathecal treatment. That's a treatment where we go into the lower back and the spinal cord fluid to get it into what's called the thecal sac, which is the area around the spinal cord. We take out some spinal cord fluid and we put the stem cells in so they can go up the spinal cord to the brain. This helped her a lot with memory issues, as you'll learn about when she gives her explanation here further in the video. We've been helping a lot of people with brain issues, from traumatic brain injury to stroke recovery to even memory issues with this procedure. It's been very effective, and you'll learn more about her experience with that later. She even fixed some sinus issues with it too, which was great to hear. So stay tuned, check out DBC Diaries episode 34. I'm Josh, happy to help. DBC Diaries Day 1. Today, Beverly's arriving. She's going to meet our driver at the airport. He's then going to get her to her hotel so she can rest and relax. Going through the airport, it's very easy. Customs can take a little while since it's an international flight. Just know that. And when you come through, once you get your baggage and everything in baggage claim, you go through, you'll get into a big open area. You'll see a lot of people waiting for other people there. And in the middle of the airport is the information booth. That's where our driver will be waiting. You can meet them there. They'll get you a printed copy of your itinerary. You will have already been sent your itinerary via email before. This way you got a new hard copy there, and we will get you to your hotel to rest and relax on this first day. DBC Diaries Day 2. So Day 2 for an IV treatment like Beverly's doing is blood work. Patient comes in, we check some vital stats like blood pressure and O2 monitor, all those types of things. And then we do a quick pinch, take some blood, get that ready for analysis. After that, we go upstairs with our admin team and take care of payment for treatment. And that's it. It's pretty quick process. Usually you're only at the clinic for half an hour to an hour. You can get back to your hotel to hang out at the beach, rest, relax, or do whatever you want.
El día de hoy viene Beverly por su bloodwork. La recibimos en esta habitación, le tomamos los signos vitales como son la temperatura, la presión arterial, después el peso y la talla. Tomamos la muestra sanguínea que se enviará al laboratorio donde se obtendrán los resultados del perfil requerido.
DBC Diaries Day 3. Today is treatment day. So first we'll sit down with the doctor. They're going to go line by line through the blood work. Make sure you understand exactly where your health is at. In a case like Beverly's, for returning patients, we're going to compare to your previous blood work, see what improvements have occurred, so you know what's going on, how well the stem cells are working, and just find out how patients are doing from last time versus this. If you're a new patient, it's just answering any questions. And then once that's done, we go into treatment room. It's a really simple IV treatment. The cells are going to flow through your body. It takes about anywhere from 1 to 3 hours, depending on how many cells we're doing. We always start with the IV. And then when it's done, we always hang a bag with some NAD+, some vitamin C, and CoQ10, just to help patients, feel a little bit better. Think of the stem cells as a manager on a construction site, and the vitamins are like the bricks to build the house. Just want to make sure there's enough material there to work with. Beverly also did the facial treatment, which we do the stem cells with 20 million stem cells mixed with PRP, platelet-rich plasma, injected throughout the face with an insulin needle. And then when that's done, we have this really cool device. It's needle-free, and it uses what's called electroparalysis to push. It basically opens up the pores to be able to force then these stem cells and PRP in through the dermal layer. When that's done, actually, you'll see here with Beverly, we're going to sit down and just go over how her treatment was last time, how she's doing versus now. So stay tuned with that. DBC Diaries, episode 34.
So today we're going to do the IV treatment and the facial treatment to Beverly. In the facial treatment, I'm going to mix the PRP and the stem cells, and I'm going to put in the whole face with injections. After that, I'm going to take only the PRP and I'm going to put in the whole face with the Mesojet machine. This machine helps to introduce the PRP inside the skin, but this one is without needles.
Welcome to DBC Diaries, episode 34. I'm here with returning patient, Beverly. Welcome. And you were here, what was it, about a year ago, right?
Yes, about.
Great. And you came because your daughter Kim had been coming to us for quite a while, and she recommended you come and wanted to focus on memory.
Yes.
So we did the intrathecal treatment, and how have things been going? It's been about a year.
Yes, we've noticed quite a difference, and something I want to explain too is that I had to have some dental work done, and they had to move my sinuses.
Oh, wow.
And it appears to me, and even my dental expert told me that that procedure that I had apparently helped with healing from that, because
Really?
it was quite traumatic.
Okay.
But it did, and I used to get really bad sinus headaches, and now I'm not getting them anymore. So that was the bonus.
Oh, that's awesome.
But then in addition, I have been able to focus better and do notice some improvements. But when you talk to my daughter,
Yeah.
she'll let you know how much more she notices it than I do.
Great. And she's going to be doing treatment tomorrow, so we'll do a video with her too, and she can comment on that. But that's great to hear. So you're back again. Now we're doing the IV.
Yes.
This will drip through, help with the body, inflammation, everything there. And we're going to do this time, well, actually last time you did also some modafinil, right?
Yes.
So if you're not familiar with modafinil at home, this is a medication. It's considered a wakeful agent. And there's actually some pretty cool research going on with it for memory and Alzheimer's, dementia related, because it does get more oxygen to the brain. So there's actually this clinical psychiatrist here in Mexico that's been studying it and finding some really good results there. It's not like a cure, but it is helping people with better cognitive function. It's very popular in with computer programmers and Ivy League kids, like in schools. And Harvard and Oxford have done tons of studies on it, found it to be super safe. And what it does, since it's a wakeful agent, I'm sure you could comment, but it's not like taking a stimulant, right? It's not like drinking coffee. It's just, you feel like you got 12 hours of sleep. Yeah, I mean, I think that's the best way to describe it. And when we were talking earlier, you said you like the smaller dose like I do, right?
Yes.
So a normal dose is, I think, 200 milligrams. I usually only take 50 or 100 milligrams. That's really where I feel best. So one box comes with 28 pills. It lasts a long time. So,
Yes.
And it's not the sort of thing you use every day, but if you didn't get a lot of sleep the night before, well, it's a great way to make the most of that day. And what's cool is it's not like, say, Ritalin or something like that, where you feel,
Adderall.
where you feel like, burned out the next day, like it took all your energy, because it's not producing more dopamine. So it's just shutting down the receptor that tells you have too much dopamine. So you drink a cup of coffee and that dopamine just keeps flowing. So you stay in that zone.
Okay.
So that's kind of the difference. So
Right.
it's really cool. I'm glad you got some more, because this is a great tool and definitely helps the brain. And then this time too, instead of doing intrathecal again, we were doing some cerebrolysin. So this is a medication that has been approved all around the world mainly for traumatic brain injury, stroke recovery. They're using it sometimes in like Alzheimer's, dementia cases, but there's a lot of people out there now using it for brain optimization, because it's 14 peptides. They're small enough to get through the blood-brain barrier, and they get in the brain and they help you heal. So we're going to have you do this. Now, it's a literal pain in the butt, like we talked about. They are vials, as you can see here, and each vial is 10 milliliters. And what you're going to do is you're going to get 5 milliliter syringes. You're going to dip them in. You're going to suck it out. So you have 2 of them. You'll inject one and then keep the other for the next day. And you'll do 1 shot every day for 20 days.
Okay.
You don't want to do it more than that. It is nearly bioidentical, but it's just off enough that if you ran it nonstop for like a year, you would probably start having some immune response that wouldn't be so good. But for 20 days, not an issue. And you can do it about as often as once every 6 months, but you've already done the intrathecal, you're doing the IV. This is just like the cherry on top. This,
Excellent.
yeah, I noticed when I did it, my reflexes got way quicker. Like something would be falling off the table and I wouldn't even think, and I just grab it. So it's lots of little details that you'll notice more of. It's good for that.
Okay, great.
Cool.
So that is definitely recommended when you do the intrathecal?
Yeah, I mean, not everybody does it at the same time together. But they work together. So you've already had the cells there. Those are guiding the repair. Think of the stem cells as like the manager on the construction site. They're telling everything where to go. They work via these signals they send out. The peptides like this that get to the brain, that's like having more workers on site. So you're going to have even more now because we're doing the IV. Now this doesn't get a lot to the brain, but it's why you're feeling a little relaxed right now. We put some melatonin in first. I can tell you're.
I'm feeling it.
Feeling very relaxed. It does that for everyone, and that helps open up the blood-brain barrier for about half an hour or so, and that means more of these will get to the brain. Melatonin is also the most antioxidant thing out there. So they're finding in studies people are doing up to like 100 milligrams per night sublingual. And you heal when you sleep, so that makes sense.
It does make sense.
Yeah, we had this guy come in, Dr. Reinikoff. He's like the top eye surgeon in Beverly Hills, and he was involved in a study with this. He also has a PhD in molecular biology, so he was explaining how just beneficial high-dose melatonin can be because of the antioxidant effects. He goes, it's not just to make you tired, it's actually because you heal when you sleep. And if you've got more antioxidants, you heal better and faster. So I personally have started taking 30 to 36 milligrams sublingual every night before bed. And I don't have sleep issues, but oh man, I sleep like a baby and I wake up feeling great. Because I found it like 10 milligrams or 5 milligrams, I actually feel worse the next day. I don't know why. I usually don't sleep that well, but with the higher dose, I sleep like a baby and I just feel great. So there's definitely something to it.
It's interesting. I didn't know this.
Yeah, and I recommend it to all our patients. Like after treatment, it's the only supplement that has any sort of studies that actually show it can help the stem cells work better.
Really? Wow.
So just a little trick, you're gonna get every little ounce out of treatment. So
I think this is a good thing.
Yeah.
And I just wanted to remind you that I had the family history of having dementia and as well as Alzheimer's. So, it's an extra concern for me and glad to have the little boost here.
Yeah, you want to stay ahead of it. Like my dad had Lou Gehrig's, so I've done the intrathecal twice. I'm like, just in case, I want to stay ahead of everything. So it's the best thing you can do.
Yeah, I want to take after you.
You're doing good.
I started a little late though.
Hey, better late than never. So, well, Beverly, thank you so much for sharing with us. Thank everyone at home. And if you want to learn more about stem cell therapy, just check out our website. It's www.dreambody.clinic. Scroll down on the homepage. You'll see all the treatments listed. You can click on the links. It takes you there, shows prices, info, studies, everything's there. You can call us toll free at 833-445-9089. I'm Josh. Happy to help. And I'm here with returning patient Jennifer. Welcome back.
Thank you.
And so you've been here a few times, and this time you came with your mom again, like last time. And I think I'd love to start there. Your mom came, we did one of the DBC Diaries episodes, and she did the intrathecal treatment last time for her brain. But she mentioned you noticed the most the improvement in cognitive function, or at least that's what she was saying. What have you noticed?
Absolutely. So going back before she received the treatment, she comes out and visits us. And in the last couple visits that she came, my husband and I were talking, and it was kind of bumming us out bumming me out, especially because when we would have a conversation, she wasn't following as much. And if we asked a question, all of a sudden she would be like, what? I'm like, Mom, we were talking about this. Oh, I'm so sorry. Or a lot of times if we were talking, she would interject because it's like she wasn't there and then she had a thought and she would just interject.
Got it.
So after the treatments, even after the first time she came out to visit, it was probably 2 months after we had come here and she had it.
Okay.
So then we went back home and she came and visited us. And even with that time, we noticed. And what was really cool is that my husband noticed.
Yeah?
Because
Okay.
he's like, I don't know about this stem cell stuff.
Okay.
But he was really on board because what we noticed is she was following conversations and she remembered better. Like she doesn't think she has I think sometimes it's harder to know on ourselves.
Yeah.
But Trav and I were like, Mom, there's a difference with your memory. You are really staying with the conversation.
Oh, cool.
And you're remembering things from that we were just talking about, like even 5 minutes ago. So, I mean, this is very exciting. And so I want to do it now because it's, for preventative measures,
Yeah.
because it's in the genes, but I'm very excited. And so then the second time she came, I hadn't said anything, but my husband did.
Yeah.
And so it's just very exciting. It's honestly, I am a true believer in the stem cells.
Super cool. So we did the IV for her now, and she's going to do some cerebrolysin now, which is this medication, and that'll get to the brain. It's 14 peptides, can get up there, and hopefully we'll take it even further. Just keep that going and keep your mom remembering well.
I love it.
DBC Diaries Day 4. So that's it. Treatment's done. Beverly knows the deal. It was very simple for her. And now we're going to get her to the airport, drop her off, and wish her a bon voyage. We love helping people here. We love seeing returning patients. We're so glad that she was willing to share this experience with all of you there at home. If you have questions about stem cells, please give us a call anytime. Toll free at 888-704-3977 or check out our website at www.dreambody.clinic. You can scroll down on the homepage. You'll see all the treatments. If you're interested in the intrathecal, click on that. Have all the info, studies, prices, or maybe the facial or the IV. Any of those treatments and all the others are listed there. So take a look. I'm Josh, Dream Body Clinic. Happy to help.